Disclaimer: this podcast is for educational purposes only and is not medical advice. Always consult with a qualified healthcare provider before beginning or changing any treatment, supplement, or peptide protocol. Welcome back. Today we are diving deep into the world of HCG, also known as human chorionic gonadotropin. This peptide, or more specifically this hormone, has been around for decades and has been used in both traditional medicine and modern wellness approaches. Many people have heard of HCG in connection with fertility treatments, while others know it from weight management programs. But what exactly is it? How does it work? And why has it become such a topic of interest in the peptide world? That is what we are exploring today. Let's start with the basics. HCG is a hormone that is naturally produced during pregnancy. It signals the body to support the growth of the fetus by maintaining the production of progesterone and estrogen. Outside of pregnancy, HCG has also been studied and prescribed for very different reasons. Doctors often use it in fertility medicine, particularly for women who are trying to conceive, because it can stimulate the ovaries to release eggs. For men, it can signal the testes to increase testosterone and sperm production. When we talk about HCG in the context of peptides and wellness, the conversation often shifts toward hormone balance and weight management. Some clinics and protocols have used HCG alongside very low-calorie diets. The theory behind this was that HCG might help the body access stored fat while preserving lean muscle mass. However, it is important to note that research has shown mixed results here, and many experts debate whether HCG itself is responsible for the weight loss, or if it simply comes from the calorie restriction. Still, HCG has unique properties that make it useful in certain contexts. For men who are using testosterone replacement therapy, one challenge is that the body may reduce or even stop its own production of testosterone because it senses outside supply. This can shrink the testes and reduce fertility. HCG can be used to signal the body to keep producing testosterone naturally, helping to preserve both testicular function and fertility. This is one of the most common modern uses of HCG outside of pregnancy. So, how is HCG actually administered? It is usually injected either subcutaneously under the skin or intramuscularly into the muscle. It is available in international units, which is different from milligrams. Doctors may prescribe dosages ranging from a few hundred international units a couple of times per week, up to higher amounts depending on the goal. For fertility treatments, doses can be quite high and timed very specifically. For hormone support in men, smaller and more regular doses are more common. One interesting point about HCG is that it is considered a glycoprotein hormone rather than a short-chain peptide like many of the other compounds we talk about. But because it functions in similar ways, and because it is used in many of the same wellness protocols, it often gets grouped in with peptides in general conversation. Let's talk about the benefits that people report when using HCG. Men on testosterone therapy often notice improved energy, mood, and sexual health when HCG is included. They may also notice that their testes remain more full and functional compared to using testosterone alone. Women who use HCG in fertility medicine may find it improves their chances of ovulation and pregnancy. And in certain weight loss clinics, patients report improved fat burning and better preservation of muscle. Of course, like any hormone therapy, there are possible side effects. For men, HCG can sometimes raise estrogen levels because increased testosterone can convert to estrogen. This might lead to water retention, mood swings, or gynecomastia. For women, side effects can include headaches, mood changes, or ovarian hyperstimulation if high doses are used. And for anyone, improper dosing or using non-prescribed sources can pose risks. This is why professional guidance is critical. HCG is a prescription medication in many countries. It should only be used under medical supervision, especially if it is being combined with testosterone therapy or fertility treatments. Now, let's dig into some of the myths and controversies. One of the biggest is the HCG diet. This was promoted as a rapid weight loss plan that combined HCG injections with an extremely low-calorie diet, often as low as 500 calories per day. People did lose weight, but studies suggest that most of the weight loss was due to the severe calorie restriction, not necessarily the HCG itself. The FDA has even stated that HCG is not approved for weight loss. However, in wellness circles, some still believe that HCG helps regulate hunger and preserve muscle during dieting. The truth likely lies somewhere in the middle, and individual responses can vary. Another area of interest is how HCG interacts with the hypothalamus and pituitary glands, the control centers of hormone regulation. By mimicking certain signals, HCG can trick the body into maintaining hormonal balance even when outside testosterone is being used. This is why it is sometimes referred to as a fertility safeguard in hormone replacement protocols. Looking forward, research is still ongoing. Scientists continue to study how HCG may impact metabolism, how it can be best used to support hormone therapy, and whether there are new applications for both men and women. Some researchers are even exploring how HCG might affect mood, energy levels, or neurological health, though these areas are still in early stages. For anyone considering HCG, the key takeaways are this. First, it is a legitimate medical hormone with real clinical uses. Second, it can play a supportive role in fertility, testosterone therapy, and in some cases, weight management. Third, it should always be used with caution and professional supervision. If you are someone interested in HCG, ask yourself why. Is it for fertility, hormone balance, or weight management? Then speak with a knowledgeable healthcare provider to see if it fits your specific needs. Remember, every body is different, and what works well for one person may not be appropriate for another. Disclaimer: this podcast is for educational purposes only and is not medical advice. Always consult with a qualified healthcare provider before beginning or changing any treatment, supplement, or peptide protocol. Thanks for listening, keep learning, and stay curious.